Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about alcohol and pregnancy. In fact, alcohol before you're pregnant, during pregnancy, and after. And the short answer is no alcohol while you're pregnant. Alcohol is a teratogen. That means it can cause birth defects. It is the number one cause in the world of mental impairment in children. So excessive alcohol or alcohol during pregnancy can cause miscarriage, birth defects, facial deformities, neurobehavioral developmental problems, emotional problems, mental development problems, something called fetal alcohol syndrome, changes the face, all kinds of problems. So it is serious and you need to avoid alcohol in pregnancy. That being said, I often get a question from patients who say, well, I got pregnant, I was having a bunch of drinks. Am I okay? So 50% of all pregnancies are unplanned, and alcohol does reduce your inhibitions and maybe influence you to make poor decisions. So if you are planning to get pregnant, it's a time to really reduce your alcohol intake, avoid binge drinking high amounts. The day you're pregnant, alcohol levels are unlikely to have any long-term consequences to a baby, so certainly wouldn't encourage you to even consider ending a pregnancy or worry about that pregnancy. But the longer you go, the more into the pregnancy, the more harm that can occur. So as soon as you know that you're pregnant, that's the time to curtail your alcohol use, and especially if you're planning on getting pregnant, be prepared, plan for it, and reduce your intake. If you are finding yourself having a difficult time, that's the time reducing or eliminating alcohol in your life while you're pregnant. You definitely need to seek help. There are counselors, there are people to help, because it is a serious problem, as I've mentioned to you. Also, after the pregnancy, if you're breastfeeding, it is an old folklore to suggest that drinking alcohol can increase your breast milk, and that's been disproven. So we do encourage you to avoid alcohol during breastfeeding. You're tired already, and alcohol is a depressant. That being said, if you have one glass and breastfeed 3-4 hours later, one glass of alcohol, then it's unlikely to have a significant effect. However, enough alcohol during breastfeeding can affect the baby's development, behavior, sleep patterns as well. So overall, the less is better, and avoidance when you're trying to get pregnant. Once you're pregnant, really there is no safe amount. High risks with higher amounts, and seek help if you're having difficulties with that issue, and afterwards with breastfeeding, again, limit to avoid. I hope you found this information of use, and please leave your comments. Thank you.